And we're live.
Okay. All right. Good afternoon, everybody. Glad that you all could make it today. Today, we want to just spend some time sort of thumbing through the plan that's responding to the executive order. We had not had a work session per se to talk about it, and we're going to need to vote on it in another week or so. So I thought this would be a great time for us as a council to begin to go through it and get a better understanding and ask any questions that we may have regarding what we have in hand right now. I think the final, I'm not sure when you got what is like the final draft, but I was going through mine again today, and I guess I still have a number of questions, but I will open the floor. First of all, to Mayor Warren, are there any points you'd like to highlight before we sort of go into our own review?
Yes, I would just like to talk about the process that we went through. Thank you for appointing Vice President Lightfoot as well as Councilmember Melendez to sit on the committee. We were joined by members of the PAB, the executive director and its chairperson, Shawnee Mitchell from law, as well as Reverend Stewart from UCLM, and of course, former Deputy Chief Wayne Harris from the Race Commission. We had several meetings to go through a lot of the information. We also had meetings with the attended by Wilmer Hill, and we had a number of people from the police department there. We received several submissions from all over the community, from the faith, 3 different faith groups submitted information, which we transferred over to you. We received several different comments, hundreds of different comments was transferred over to you. We received a document from the Public Defender's Office, which we submitted as well. And so we submitted all of the information that we received. We received a number of letters from different people in the community that wanted us to add different items. And so everything that we have received, we submitted as it pertains to public comment. We also had a teletown hall meeting. We also worked and had a Zoom work session with the barbershops and beauty salons as well, to really get a lot of public input. All of that information has been submitted to council in addendum format. A number of different comments were made, and we updated the draft, the final draft that we submitted to you. And so this is time for council to ask us any questions. Now the document is yours. I know that there may be things that you, of course, want to add or edit. And, so the document is yours, but we wanted you to know that we went through an exhaustive public comment, public input period, and received hundreds of comments. And we have transferred all of that information to council so that you can review that as you go through the document to see what was added, what was changed.
Thank you for that. Council members, any
Another note as to the layout of the document, we had gotten direction from the governor's office as a guideline. So when you look at the layout of the document in the way it is sectioned off, that's basically the way that the advisory document that we received from the governor's office laid it out. So they wanted us to do an introduction. They wanted us to do like what's our present state and what's our future state. So we wanted to include all that information in there. So if you look at the layout, it's sort of like, okay, like why is this here? That's the way that they advised us to lay it out. And so Doreen, and I want to commend Doreen Kirkmeyer for working extra hard overtime on this document because it was a lot of man hours updating, going through, looking at all the comments, reading everything and updating the document. And so she put in a lot of work, and the committee members put in a lot of work. And so I want to commend everyone that brought this document to where it is today as we turn it over to City Council to do your review of the document.
Thank you. Where you said it reflects the present state and the future state. Where's the future state information in here?
So the recommendations would be what we will be doing as changes. So reform recommendations. And that starts on page 40.
Okay.
And that's broken down into, I'm sorry. Yes, page 40.
Okay, I'm having a little trouble finding that. Oh, okay. Anybody have any questions right off the bat? They were trying to find that page he's referring to. Here we go.
So it says reform is section 7. It says reform recommendations and with accountability.
Okay, all right, got that. Okay. Questions, comments, folks? I don't know what I was looking for, but somehow I don't feel like this is it. I just can't tell you. I've got to get more specific about what I feel is missing. I just keep reading it and getting the sense that what we're proposing to do is stuff that we're essentially doing, which is not a bad thing. The only problem is it's not getting us where we want to be now. So how is it going to get us there in the future? But that's sort of a broad thing. And I was trying to pull out some points that get directly to why I get that sense of lack of fulfillment, for want of a better term. But if there are other comments from anybody, questions? Dr. Gruber.
I guess I can understand your concern and your feeling, President Scott, because we're sort of working with building a plane while it's flying. And so you're dealing with the structure that you currently have, and what are the things that you can do to repair or to change that structure. And so bringing in accountability is one of those things that and what accountability looks like. And then you go into, a lot of the information that we received from many groups was around data, wanting a lot of information, wanting to know why, who do we stop? How do we stop them? The age groups, all of that, and wanting that information to be reported out. And that's why the data section is so, it's long, it's encompassing. When you go through and you look at community engagement and programming, what's available, what can we do, new or different, what do we have? And so it's looking at that. Unless you completely dismantle and restructure, that's, you're sort of getting a document that looks at our current system, how we believe that we can work within the current system to bring about the change that we want to see: officer wellness, community wellness, all of those, changes in how we deal with mental health calls, and training, and all of that is in, the document, and, giving it time to really work within the structure. And if it doesn't work, then to try to do something where you completely dismantle, which would be a long and exhaustive sort of process. So I think that I understand exactly how you feel, because you look at it and you say, okay, well, I see all of these different points. I see all these different changes, or, things that we need to report out on, or, as far as accountability, but I'm looking at the same structure. And I think that that's where it's sort of trying to get, it's trying to get your head wrapped around, if we do this, what would be different?
Yeah, and if I could just jump in here really quickly, we did hear that from the community as well. We got a lot of comments that say, when will this happen, and what are some dates, and what are some measures, and certainly that we would have liked to have taken it to that level, but the time frame is so tight for the governor's deadline, and there are still outstanding reports, and that's why we put in this document that this is really an iterative process. And we're still waiting for information and reporting from the Race Commission, and WilmerHale is still doing their deep dive into some of these issues. And so we added that last section 8, to the document that says, we hear you, we know that you want more, and that is going to happen. And these are the next immediate steps. Now it's going to be turned, these recommendations have to be drilled into more and turned into an action plan. And so it does lay out a commitment to that action plan. So we're hoping that, by the time we get, if we had a little more time and we get these other reports in, that will help inform an action plan. And we put some deadlines around that. So that was our attempt to get to that point.
So to add to what Doreen is talking about in the conclusion section on page 56, the chief would be putting together a committee to really turn all of these recommendations into an action plan. And that committee will be comprised of different people from the community to work and put timelines to all of this, and to, basically also for implementation. So this isn't just a report that gets sat on a shelf. It's okay, now we have all of these recommendations around data, around accountability, around this and around that. How do we get it done? And, working through to hold those, the chief and her team accountable, as well as, us all accountable on getting these recommendations implemented and done, from, our response to mental health costs, to our response to collecting data and putting that information on the open data portal, but all those timelines to be laid out.
Okay, anybody else? Because
Thank you, President Scott. Mayor Warren, one question that I have in particular, just in terms of general framework, is how this actually is going to, what the crosswalk over to the budget is going to be. There's a lot of conversation about money and dollars in here, and I understand this had to be produced prior to a final draft of a budget, but I'm wondering if you could give a sense of how that crosswalk will work.
So as it pertains to training and all of that, our hope is to be able to not only start to get, the chief and her team are already looking at different trainings and, looking at how to have our officers, all of our officers, all 728 officers, go through the training process on racial bias, on, implicit bias, on, different trainings that need to go through and all of that. So they're already, documenting and looking at the different trainings that we would want them to take, and the cost. And so they're assessing that right now. As it pertains to the open data portal, you're going to have to get, the information and have the system. As you know, we have many of our systems are outdated. And so we have to update IT systems. We need to update our body worn camera system on the back end. And so we're getting the dollar amounts for that as well. So when it looks, and when you talk about the person in crisis team and more for that. Those budgets are being compromised, and of course, the commissioner is working on getting all that data and information so that that's included in the budget as well. So when we look at all of this, it's not necessarily, you don't have the dollar amount in front of you, but part of it is to really look at, okay, this training will cost this training will cost that, this, these many staff people will cost this to do this particular program, and moving full speed ahead on that, information gathering and submitting that to council in the budget cycle.
So I would hope that whether it's actually included in the budget, it would be delineated in increment descriptions, because the things that are in here, there may be no way that you can include all of it in the budget that's coming up. I don't know what we know about the money that's coming in, but there should be some evidence that we've actually taken to heart the need to do those kinds of budget projections and put them on increment forms or something, so that we can see that they will put in what we can put in now and then project outward what it would take going forward. But you should be able to see that, which is sort of like a commitment.
Absolutely. I think that, when you get the budget and when we break this down, and that's part of the reason why when you look at implementation, and getting and having that committee really look at, okay, these are the things that we need to do this is things that we can do immediately. These are things that we can, that we need to do immediately. These are things that we need to move towards, and this is how much it's going to cost us to do those things. And, that's how you get there as it pertains to implementation. Of course, these are not all things that you can do overnight, but the hope is to be able to do it in a way that, as far as the budget is concerned, it's implemented over time. But there are some things that we need to do expeditiously, and the commitment is there to do it right now.
I think, President Scott, do you mind?
Go ahead.
I think maybe one of the things that you were getting at about the way that it feels is that some of the language is very hopeful and aspirational, whereas we know we have a budget cycle coming up soon, and some of these things I would hope we'd be able to actually begin to do now. The one that strikes me as the most kind of compelling around that is there's a lot in the beginning of the document that lays out the current state, which talks about how we have a particularly big police department. We have a police department that outsizes almost every other city of our size. And yet when you get to the actual recommendations, there's 1G, resizing the RPD, and the language used is aim to reduce RPD personnel within the next 5 to 10 years so it can reallocate these resources to other programs. And I think that the verb there, aim, and then the time frame of 5 to 10 years, it's hard to know. It's hard to know what this document's actually doing for us when this year, in 3 months, we have a budget to vote on that we could potentially start to do some of that work now. And I guess that's my question, is why not move some of the timelines sooner?
So when we talk about resizing the RPD right now, the executive deputy chief is going through and doing that assessment of our RPD. And we also have a union contract where you have certain right to work rules and regulations. And so, if you're going to, so you can't look at these separate and distinct. And so we have to look at them jointly, and that's what they're doing. That's what he's looking to do right now. So I don't want to, there are certain things that are going to have to change. And so some of this is going to be, state law has to change. But other parts about this is, looking at, okay, what do we currently have, and in doing a complete assessment of that, and what do they do, and can it be reorganized in a different way? And they're doing that work right now. I don't want to tell you that it'll be done in a month, because that's not right, and it's not fair, and it's not going to give you a great assessment. But, to say that we will we will do this in 6 months, or, you know, what the chief is aiming to do is look at it right now, bring forth a plan, but also working to bring in the community to be a part of that plan, is very important for her to be able to do. So if I said, okay, resize the RPD and lay off, you know, 30 officers, or, you know, cut it in half by this amount, the next question is going to be is how are you going to do that and keep us safe? How are you, you know, or you know, those types of questions for some people in our community. So we want to make sure that the messaging that we give is the correct messaging, and that, yes, we are working towards this, and they have outlined a plan on how to actually get there, with changing how we actually do business in the RPD.
I'll just say my last piece on this, and then I won't hog the mic any further, Mayor and President Scott. But in this particular case, I understand that, right, the idea of right sizing anything, especially something that's taken years, decades to get to the size that it is, that doesn't happen in a month or 6 months. I totally understand that, and please don't assume that I'm asking anything otherwise. But I'm sorry to be a stickler on the language here, but the verb aim, you know, we could start to resize the police department in 3 months. That doesn't mean we're going to get there. That doesn't mean it's not a 10-year project. It very well may be a 10-year project, but it doesn't need to start in 5 to 10 years, and we don't need to aim to do it. We can just, if we've made the decision that it's too big of a department, that we need to allocate resources to other things like the PIC team, we don't need to aim to do it. We just need to do it.
So the document is yours, and that's why it's a draft. Change it.
Okay. I didn't know what the process for that.
So I mean, we gave you a final draft document, and I think that this is part of, you know, this is what we heard from the community. If there's language in here that council would like to change, you know, this is what, you know, I'm not advocating for this particular document. We were, you know, I'm giving you what we came up with, and now it's yours to either accept and to accept and say, okay, fine, you can go forward with it, or to adjust. And because at the end of this, you have to pass this document, and you all have to be comfortable with what's in there. And, you know, I think that it's only fair that you know, pass a document that you're comfortable with. So if there's language in here that you don't think goes far enough, or you want the administration to move faster, then I would say that, you know, that's why we turned it over to you to be able to do that. We turned over all of the information that we received, meaning all of the comments, all of the reports, everything that we received, for you to be able to go through and to digest it as well, and to make the adjustment to the document. And once you do that, you know, once you make those adjustments, you send it back to Daraine. We'll update the document into a final document, and, you know, you'll have your special meeting and pass it so that we can get it to the governor.
Okay, fair enough. Comments?
I have a question.
Yes, Councilmember.
Mayor, you said at the beginning, you know, that we're working with inside the existing structure, and then if that doesn't work, we'd consider kind of restructuring and moving outside of what we currently have. Do you have an idea of, you know, what it would take, how long we might evaluate before we might come to the conclusion that we need a different system, or that we need to restructure?
So we're constantly, when we talk about resizing and doing an assessment of staff and what they're doing, we're doing that right now. When it comes down to changing of behaviors, right? And so, you know, one of the things that we put in here is the right to advocate for and wanting to be able to fire an officer for cause immediately, not having to go through that process. We know that that takes state legislation. Well, what happens if that never happens, right? And so, you know, a number of people through the comments period also talks about Camden, New Jersey, and what they did. Now, Camden didn't necessarily go to the state. What they did was they dissolved their police department. They worked with the county, their county, it would be our county sheriff's department. But they came up with a way to combine the sheriff's department with their police department and be able to hire, you know, those officers that really, that we're not acting outside of the policies and procedures. So that's an option. If you look at the conclusion, we talk about that as being an option, but I don't know if the county sheriff would even go for that, right? So I don't want to put something out there that, for Camden, that's what they did. It wasn't the state actually giving them the power to do that. It was through an agreement with their county sheriff or their county's police department that they were able to do that. And so we have many, intermunicipal agreements with 911, our library system, so we've done this before, but not necessarily with policing. And so that would take a longer sort of discussion. So, I don't want to tell you that, it'd take 6 months, it'd take a year, because I don't know. It would have to depend on rather there's the political will to do so.
And not necessarily advocating for combining with the county sheriffs, but Minneapolis, has a different idea and combining it with a public safety department. And I know that's kind of discussed in there. So I think it's just, it's good to know that that's on the table.
Yeah, Minneapolis, they cut their police budget in half. And just last week, I believe
They put it back, didn't they?
they had to pass legislation to put it back. So, doing something in haste may not benefit you, may not be as beneficial in the long run. And so, yes, Minneapolis did a number of different things, but they are going back and reverting back to the way that it used to be because of what they're experiencing in their city.
My other question is about implementation. Can you say more about the implementation committee?
So, right now it's all in a draft format, and the chief didn't necessarily want to move forward with that portion of it. I'm sorry she wasn't able to be here. She had, an emergency that just came up, but the hope is to have people, someone from council, we asked for a recommendation, but have people from the community, people that was actively involved in submitting documents for this particular issue, to reach out to them, to ask them to be a part of the implementation committee immediately once it passed. Because, we didn't want to just move forward with that portion of it without having, the support to say, yes, this is the way that we want it to go.
Okay. And just the kind of questioning and flagging the decision to have the chief head that committee, just to be frank, it seems like putting the police in charge of reimagining themselves. And, wanted to get your thoughts on that.
So, sometimes right now, the structure that we have, the person that has to make the changes is the person that has to make the changes, of course, is and implement the changes is the chief in the current structure. There are other suggestions and other things that may come forth in the budget that may be different, but we're not ready to talk about those things just yet. I'm just saying that at this point in time, the person that needs to implement the changes is the chief. So if you don't want her to do it, then my thing is like, look, this is a final draft from the administration to council, right? And so if there is a different stance that you want to take on it, then I would say that council would need to, edit the draft and make those changes. But I would just say that you need the chief in order to make the changes that, to implement the operational changes that you're looking for.
Yeah, and I understand that. I wasn't advocating to not have her be part of the committee, but to have her necessarily be the final say, I would question. But thank you.
So I'm not saying, when you say the final say, the document is a living document. So my thing is that it's what's in here, you implement and you bring in a time frame to do so, and you work to bring forth those things. So that's what I'm saying. So it's not that, I'm not going to do this. If it's in the document, our plan is to try and get it done, to get it done.
A little bit.
Okay, anybody else?
Yes, Madam President, I have a statement. Just looking at going back to the resizing RPD conversation, I think we need to do two things in that vein. One is resize the job first. I think over the years, the 911 response system has just grown the amount of things that RPD responds to. And I think we need to take a deep dive into that. And it kind of goes hand in hand with the mental health conversation that we're having. I think when it comes to mental health responses and crisis, we really need to look at, what percentage of calls are going there and what is the mechanism that would trigger a different response, and then what is the appropriate response. I think a co-response model and some other types of models, we really need to dive deeper into that because this has come up too many times recently, I think, and we have to figure out a different path forward. But I appreciate the work that's gone into this document. I think there's enough here to revise and edit. I do think, though, that this is going to have some budget implications for it to be effective.
In considering, I'm sorry, go ahead, Mayor.
No, I was going to say that, I definitely agree. And I think that, and that's part of the reason why with the person in crisis team, when they looked at, how do we start and move forward, but do it in a way that is methodical. That's why they took off the first section of that, from 911 to be able to respond. And their hope is to ramp up to be able to respond to these other calls that may not need a RPD response. And so, they have looked at that information, looked at that data, and I would definitely encourage you all to talk to Commissioner Danielle Lyman-Torres about that, because I think that right now it would double the amount of calls that they will be responding to. And, she's already working towards getting there and hiring, staff and other things to get there based on what we're hearing and the need and the need that we know we need in the community.
We've the issue of mental health and our response to that has come up with increasing frequency. And I think some of the stuff we're doing in response to it is really good. But what troubles me is that we're working on responding to the calls in some way. What I'm not seeing is what happens after that, because we, the city, are actually not funded or structured to provide health services, mental health or otherwise. And I don't hear any conversation, and it may not go here, but it seems like it couldn't hurt for us to look at how does the state get back in on this conversation? How does the county? Because you could take the call and avert the immediate crisis, but the person obviously needs help. So where does he or she go after that? We're not a part of that and can't fund it.
Well, actually, I'm glad that you said that, President Scott, because those are the discussions that we're actually having because of what we've seen with the PIC team. And seeing is that a lot of the people that they have encountered have had contact with mental health professionals out in our systems. And either they're lost or they stopped taking their medication, they stop, something is broken in the system. Mm-hmm. You have this crisis that you're responding to. So we've had discussions with the University of Rochester Medical Center, Rochester Regional Health, many of the mental health providers, and that is something that the commissioner is definitely working on. And they're already sort of building those connections, but you'll also see, and I know that tomorrow the Race Commission's report will be released, but in that document, there is a lot around mental health and a unified system that is being provided, that's being called for. in that document as well. And so, you know, I had a chance to briefly talk to the county executive, and we're going to meet to talk about exactly what you just said, not just on this particular issue of mental health, but on a number of different issues that overlap, housing and other things that overlap between the city and the county, to get that understanding of, okay, what are some memorandums of understanding? What are some ways that we can work collectively together? Because social services, the bulk of it is in the county, but effects of it is in the city. Be able to bridge that gap in a realistic way, and we can't do it by ourselves. And the Race Commission report helps us with that. And you'll see a similar, sort of, push for, okay, we have this document now, how do we implement, how do we move forward, and how do we make sure that the resources are allocated to getting it done? And that is not something that the city can just take on by itself. It has to be in partnership, and those discussions are already happening.
I did just want to add to that. I agree with absolutely everything you said. We can't do this alone, but just wanted to add that the PIC team does do follow up for 90 days. So a lot of these cases that they've seen, they have been working with the families.
Other comments?
Yes, President Scott, Councilman Pio.
Yes. Mm-hmm. Councilman.
So if we're going to look at limiting the amount of police officers that we have on our streets, the next iteration would have to be something that kind of encompasses technology, AI, robotics. Have we discussed that at all? What that looks like in a city in the future where our policing has turned from personnel to technology?
I'm not sure I understand exactly what you're talking about.
So when we're talking about, like, we have the shot spotters, but we need something better. We're gonna need drones. We're gonna need something that when shots get shot off, cameras turn on, and then we're looking at facial recognition and the license plates on vehicles, because it's not getting any better in our city right now, and people are getting, fed up and going to start taking it to them to doing it themselves if we start taking police officers off our streets. So there's got to be something that comes next, and it seems like that's a road that a lot of cities are going to go to with defunding police. That funding will go somewhere to keep the public safe. And I'm sorry, but I don't think mental health people are not going to be arresting. It's going to be something else. So is that discussion being made?
So I think that, respectfully, Councilmember Pio, the conversation around technology and facial recognition and all that, we're not having that conversation and discussion because what we are talking about in this discussion about defunding the police. No, what we're really talking about is what Councilmember Melendez was talking about earlier. We have piled so much on our officers that they're responding to and being a part of a system-wide, just give it to the police, just give it to the police. Whereas that's not necessarily the best answer. There is a better way for us to do certain things. And, when we talk about mental health in particular, there may be some cause that, of course, police officers would have to respond to. But as Council President said, if you're looking at the entire system and what we see, many of the people that our officers encounter that are in mental health crisis are being seen by someone else. They're being seen by a mental health or have been seen by a mental health professional. They may have stopped taking their medicine. Their family, I can't tell you the number of family members that have called that said, I've tried to get my loved one committed and I can't get them committed. I know that they are having a problem, but until they hurt someone or hurt themselves, I can't get them in a system. That to me means that there is a system that is broken and the dots are not being connected. And our hope is to be able to save people before they get to that point. And this is a way for us to be able to do that without criminalizing people And we don't want a criminal state. We don't have to have a criminal state. If you look at the data, and the data tells us that a lot of our crime happens on 5% of our streets. So if a lot of the crime happens on 5% of our streets, and we're able to target our police resources to those areas where we know that this situation is where more likely than not, this is going to happen, we have to do policing differently than we've done in the past. And that's what we're talking about, not necessarily going to a criminal state where you're utilizing all this technology and robo stuff and facial recognition and all that, but more so that we're utilizing our police officers in a way that can keep people safe, and they can be guardians of the peace instead of jumping from call to call and doing things that are not really keeping our community safe.
Right, I get that, but we're talking about reimagining police for the future, not right now. We're already well past what we should have been doing. So if we have police stations on, near Lyle, near Clinton, and they have hundreds of police officers there, it's not working. So if we're going to talk about reimagining police for the future, we have to talk about AI. You might joke around and say RoboCop, that's funny, but AI is not something that's far in the future. It's very close to right now. We don't have anything that we're looking at for that.
That's correct. At this point in time, we are not looking at AI.
Right. I'm saying maybe we should.
And for that reason is because AI actually, from all the data that I've seen, it, especially with facial recognition for people of color, it is not a good thing. And I am not one to want to criminalize people for being Black and brown.
I have another question, President Scott, unless
Yes.
other council members have not been able to ask yet. Am I good?
Yes, go ahead. I don't see any hands up.
Okay.
Mhm.
Thank you. I think it's a little bit more of a question about process. So Mayor Warren, I appreciate what you said before about, the example I gave about the word aim and giving us an opportunity to think through rewriting or offering some changes that way. But I do want to ask a question about process. And President Scott, this may go for you, be a question for you too. Thinking through exactly knowing what the time constraints are, how we ought to think through a writing exercise like that. And that doesn't have to be something that we decide on now, but I'd be curious what the thoughts may be. I see other council members put it, added something like that in the chat as well. But then there's a question about process, Mayor Warren, from your perspective, two really interesting reform recommendations. One is consider appointing a chief resiliency officer, and one is consider reinstituting and rehiring a commissioner of public safety. And so it's this same type of question from my end. Like, at what point, what are we voting on? Are we voting on the idea of considering it, or is this actually? Do you imagine after we vote on this that Chief Harriet will put that in her implementation plan? And that's, again, something that's going to be kind of connected to the budget. I'm just wondering, how do we take the considerations and see what's actually going to be brought to fruition?
So when you get the, as it pertains to the budget process from our side, it's, of course, what we have the dollars and the resources to pay for is what we're looking for right now. And we're thankful that, our federal delegation was able to get us some resources. We're trying to figure out right now exactly how we can utilize those resources, right? And so we all know what happened last year with the pandemic. So the reason why you see language like consider is because you don't want to be definitive and you can't do it, right? You don't have the resources at this moment to do it. Maybe not in this budget, but maybe next year's, you know what I mean? And so that's why you don't want to put something, well, let me say this. The administration didn't want to put something that was definitive, because if you say it and you say, okay, we're going to hire a commissioner of public safety, right? And so when you look at, okay, do you have the resources? Where are you going where are you going to get the money from to do this? Then you have to take it from somewhere. And so when you already have a $30 million budget gap that you're trying to close, you don't want to be that definitive and, and not be able to accomplish that. So that's why it says consider as we move forward through the budget process, as we get more understanding of what we can utilize resources for and all of that. Well, resources we believe our commissioners will need to be able to implement the things that we're talking about. That's when you'll have a more definitive answer, and that will be part of the budget process from our side. However, I can't tell you what language to use. I can only use the language that that's the reason why we used the language that we did.
Sure. I don't know enough about Chief Resiliency Officer, for example. And I even like that it was, there was an example in New Jersey, a similar position. I don't know enough about that to say definitively, oh, I definitely think that's a good idea or not. I'm just trying to understand what we're voting on versus what's going to actually happen. And is it fair to say, Mayor, that when language is used like consider, the expectation is that something that would be, like you said, it's a living document, but that would not be considered for fiscal year 22. That's not something that we're going to be asked to vote on.
It may be. It may be considered for fiscal year 22, just like, the changes in the, adding more money for social workers and the PIC team. Those are things that definitely you'll see the difference in fiscal year 2022. You know what I mean? So I'm just saying that we didn't want to put the language in definitively that, we're going to do X because of the fact that we didn't know the fiscal outlook as it pertains to the resources that we would have. And so when it comes down to what you're voting on the plan to really, reimagine, redesign policing and the data and the information that we currently, are collecting to enhance that, to do things differently than we're doing it today. And also on implementation, on bringing this document back and saying, okay, when are we going to be able to accomplish these things? Or you may, as council, want to outline that, we want these things accomplished in 6 months. We want these things accomplished in a year. We want these things accomplished. We believe that we can accomplish this in 18 months. That's something that you all will have to go, talk about amongst yourselves. But for us, as it pertains to implementation, it is that, we would work with the community and everybody to look at the document to say, okay, realistically, this is what we can do tomorrow. This is what we can do 6 months from now. This is what we can do 18 months from now.
I have a follow-up on that, kind of what Councilmember Gruber was saying, trying to understand what we're voting on. It seems like the document is written with, no implementation deadlines or real specifics that we're committing to, and passed as a resolution. We're not really legally bound to anything in it, and that we're just kind of promising to do it. I think the same with the implementation. And I understand that this plan isn't the end all be all, and that we have a deadline of April 1st, but I would feel much more comfortable knowing that down the line, if not in this plan, in something in the future, that we're going to codify some of this and commit to specifics and deadlines.
Oh, absolutely. Absolutely. And I mean, if you want a implementation plan deadline, within a certain time frame, I would say that, City Council should add that to the document. So let me just be clear again that this is just a draft, the final draft plan based on the information that we received, combined together with, thoughts from all over the community, giving you everything. And, this document now is for council to do what you want with it, to update it, to edit it, and then to pass it. The administration will live with what you feel comfortable with passing. And so I don't want to tell you, you can't do something to this document because that's not the message that I'm trying to give. It's whatever we are charged with doing, we're going to implement. I can't tell you the date that, certain things will be done. It depends on, a lot of things that are, especially with data and technology, we're going through those process right now. The IT director is really pushing the envelope on a lot of things. And then you'll see coming forward that, a lot of this new technology costs a significant amount of money. And so that will be a part of some of the things that we'll need to, work on as it pertains to the budget.
Do you have an estimation on when some of the data that you're currently researching will come back?
So right now, I believe that they are evaluating the body-worn camera backend system. And that should be the next couple weeks. I believe that we have a work session coming up with the IT director, or did y'all already have that? Did y'all already have the IT director work session?
No.
Okay, so he would be able to update you on, not just this, but on, on the body worn camera system that we're looking at, on the, where land management system. And so I think that there is something, I know that we had submitted something a few weeks ago for him to come over. I think it's on the calendar. Katie or Conda, do you know what date that is?
It's not on the calendar just yet, Mayor. We're working on a date.
Okay.
What did I miss? Who was
He's
on the
ready
calendar?
to present when you're ready, when council's ready.
Okay, I lost my connection. Who is it that was supposed to be coming over?
The IT director,
Okay. All right.
to talk about all the different new technology systems and things that we're working on getting.
Okay. Okay. Other questions or comments? Vice President Lightfoot?
Yes, Madam President.
You put in a lot of time to work on this.
Yes,
Give us
ma'am.
some insight.
Well, I think that a lot of more pieces will be coming together as the race report, because I've been on both tables, so I'm a little privy to a little more information. But I think that the race report will help tie some things in together as well. And you got to remember that, ladies and gentlemen, that there are other appendices that are attached to this. The police accountability, the race will hopefully be coming very soon, within hopefully tomorrow. And you also have UCLM, and then Myra Brown, this the group, the circle of religious circle that she's a part of as well too. So there are some things.
And you also have the Public Defender's Office also submitted a document, as well as Action for a Better Community. And I believe there's another faith and law enforcement council that also submitted a document that has been sent over as well.
Thank you, Mayor. So my point being, there are several attachments of of things. I just don't want to spend a lot of time trying to reinvent the wheel when there may be a lot of information. There's a lot of information to grab here, and my only concern is the timing of it all. Of being able to dissect all of this information. There's a lot of information, and it's a lot, and it's been out there for the public for 30 days. But we have to do it in about a week and a half. So that's a lot. So I just want people to be understanding of that, and the fact that there's a lot of info. Before you go in and start thinking about these new ideas, you may find that some of those things have been addressed in one of these other attachments from one of these other groups. And it just be maybe for us to bring to the forefront, and remembering that we have total privy to amend the document, as the mayor has said before. It's not for us to change it real time right now today, but we're definitely going to have to see what our priorities are as a body. right? And again, what we feel comfortable with, looking at all of the information to include the additional information that we're going to be receiving from the public hearings that we're having as well too. So, where some more information may come, but I think there's going to be a lot of things that we're probably seeing that are overlapping themes that we probably can see throughout all of the information that we receive. And I would hope that we would do our due diligence in grabbing the overlapping things. And this may be a question for Doreen. What if we could pick the top 3 or 5 overlapping themes that have come from all the information that we receive? Is there a way for us to grab that, Doreen?
I could try and see if I can do some keyword searches maybe in the public comment spreadsheet and see if there's some things that repeat. I know for a fact that, people, I saw a repeating theme around wanting to have a plan that had more schedule and, timelines attached to it and money attached to it. And, that and metrics and, measures and metrics attached to it. So I know that was a recurring theme, but, it's just mature at this point to try to get to that point.
So what I would just recommend, just for what may be helpful for us, is if we can at least, because it sounds like a lot of those things were talked about even today as we're having this conversation. So if we were able to grab like those 5 to 10, I would say 5 things that, are just flowing through all the documents, right? And I think that would be better worth our time, right? As we begin to fill out what could we add that's missing from this document or strengthen this document, is to address the prioritizing of the overlapping things from everyone. I think that's a productive use of our time. And I just put that to the space just for consideration.
I would, from what I saw, it's accountability, it's data, it's though it is definitely, reaching, mental health is really huge on how we deal with mental health. Those are really like the big 3, and accountability, mental health, data, and resources.
Yeah, data was a big one. Looking back, PAB had a lot of data they wanted. The community wanted a lot more data. That you see that in the recommendations, just a tremendous need for more data. And I know there's a willingness on the part, of the police IT staff to get that data out there. So it's just a matter of time and resources.
Yes, I think if we were able, Madam President, if we were able to capture those themes, and then if we were able to really attach some action plan on schedule and attach it to the budget, I think we would be doing our due diligence to our citizens significantly, considering the amount of time and what we're working with, understanding that this is a working document. All of them are working documents, to include the ones that have been attached, as well as the Race Commission report, and that we'll be continually, if we put together a good enough mechanism of accountability and attach these things with a timeline, updates to the community and updates to us, along with some dollar figures as best we possibly can with what the information and knowledge we have, and be transparent and open to the community and forthright coming to them, along with measuring components to measure our successes and or not. Then I think we would have done a great service to the citizens of Rochester, being the time constraint that we've had and the amount of people and the amount of information that's been captured with Executive 203.
Right. Councilmember Patterson, you've been silent. Do you have any comments?
No, I'm pretty good for now. You know me, I got something to say. I'll say it. So for now, y'all should just enjoy the peace and quiet.
Okay. So, I hope that at the end of the day, I looked at that executive order as something that would provide us leverage that we've not had. Now, whether that is a factor or not, I don't know, but it seems that there is a body of work of issues that needed to be addressed and challenged, but we didn't have the leverage. The leverage we have now is the threat to our funding if we don't do it. So we could get more people on board with us as far as moving that forward. So I hope that when we complete this and that we see that we took advantage of an opportunity to address some issues that have been plaguing us for decades, if not generations. So that's what I'm going to be looking for when we pull together the next part of what we have to do to send it in.
Thank you, Madam President.
If there are no other I do want to thank Doreen. She's a wonder worker with this kind of stuff. We really, really appreciate the work that you've done. You and your team, you guys are phenomenal. There's no question about it. Mayor, there was a lot of work.
That's it.
There was a lot of work. And my council colleagues who stuck it out this whole period of time, squeezing in meetings in between everything, but making it happen. I genuinely appreciate your commitment to this effort. So we as a
I have one
council-
more thing before we go.
Yeah.
I know Chief Harriet isn't here, but I am seeing that there's new policies that were released. And I don't know if we've got time to talk about it today, but if there's a way that we can get briefed on that.
She can brief you on that. There were a couple of things that she believed were immediate that they needed to address. And I know that, in something that the community as well as council have been calling on her to deal with immediately, and that was to intervene. That we did not have a policy on, other officers intervening, and they wanted to make sure that that was in place, as well as the chokehold ban policy. Those were some things that were immediate and there'll be other things that she's working on doing that she's heard from the community. So there are some things that, as you all know, can't wait. You just got to get it done. And so we are going to continue to do those things, and she's going to continue to do those things. As we work through this, and that's why this is only one tool in the toolbox. It's a lot of work to be done, and we will continue to do the work.
Is that it, Councilmember Lupian?
Yes.
Okay. Are there any other questions or comments, concerns, unreadiness?
I just have one question, Council President Scott. So we are scheduled to do another work session, but I don't know if the administration has to be a part of that. I think that because it's on my calendar, but I don't think that's.
No.
Okay.
No. So the next work session, what I'm going to be asking council members to do is to present some specific recommendations for amendments.
Okay.
And we'll work through that.
Okay, so the administration, we will bow out and the document is yours now. And once, Conda and Katie updated, or if you can do track changes or whatever, so we'll know where the changes are. Not that we would change it, would do it just to know, what was changed. That would be great. And then they can send it back to Doreen after it's been tracked, and then we can put it in a, have communications, put it in another document.
Okay.
Okay.
All right. Thank
All
you
right,
so
thank
very
you.
much.